Hi everyone, my name is Aisha Khan. I'm an assistant clinical professor at the Stanford University School of Medicine. Today we're going to be talking about a really interesting case that has to do with how we can prepare for an emergency. So imagine that you're in your hospital and you get a ring down. A ring down is the EMS or ambulance provider's way of letting you know that they're bringing in patients. In this case, they tell you that they're bringing in multiple patients at the same time. At this point, you might want to think about how would you prepare for an emergency? Now we're going to look at an interesting case of exactly this kind of a situation where multiple patients are coming in at the same time.
12-year-old, minor burns and radial deformity, GCS is 15, vitals are good.
33, IV morphine, X-ray.
Let's see her as soon as we can, okay?
Annie Dixon, 37, complaining of abdominal pain and headache.
Think about how you might want to sort these patients. The sorting of these patients is called triage. What is triage?
Let's see her as soon as we can, okay?
Annie Dixon, 37, complaining of abdominal pain and headache. Tachyon hypertensive, SATs 92. Trauma 1's open. I'm Dr. Banfield.
My kids. They're doing okay, Mrs. D. They're just more scared than anything.
You heard the doctor there talking about taking a patient to trauma 1. You may have noticed that that patient didn't actually have any sort of traumatic injury. It was a critically ill patient who was tachycardic and hypotensive. What was she referring to when she was talking about trauma 1? She was referring to a resuscitation room. What is a resuscitation room?
It's Norman, the good Samaritan of the neighborhood.
They're in 3A and I'm in 4B.
Heard the explosion, ran in to get the kids out.
Yeah, let alone she likes to cook for me.
She says cereal.
You're over the crush injury to the leg.
All right, curtain 3, get Norman out. Rena, honey.
They're in
Went on
good
the ortho
hands,
cases
Mrs.
in
D.
Castro and picked up 5 more beds.
Good. This is Norman. He needs access fluids and pain meds.
Oh, no, take Mrs. Dixon. She's much sicker than me.
Yeah?
No, I got it. You help Gates. Maybe you can benefit from having an experienced resident in the room. Just in case.
Just in case what? Got your back, Johnny.
You might have noticed that there was about 3 doctors out on that ambulance bay. The physician did an excellent job of running through all of the patients. Who should triage patients in your emergency department or hospital? If you think about it, sometimes you may not have that many providers. So it's very important to think about what resources you want to put up front when patients are coming in. Next, we can think about how we should triage patients. Is there a method? This physician was just looking at all of the patients very quickly and sorting them out based on her medical knowledge. Are there other ways that we can triage? That concludes our case for today. Stay tuned for the expert discussion that will answer all of these questions.